It was a normal Tuesday morning. Margaret was making coffee when the cup slipped right out of her hand. She laughed, wiped up the mess, and blamed her clumsy fingers on a bad night's sleep. She went on with her day. 24 hours later, she was in the emergency room.
That small moment, the numb fingers, the dropped cup, was not clumsiness. It was a warning, and most people never learn to read it. I'm Dr. Ethan Kent. I've spent over 20 years working in cardiology, sitting across from patients after the worst has already happened. There's one line I hear again and again. I thought it would pass. That sentence haunts me because so often it almost didn't have to end this way. Here's the hard truth. Doctors are trained to treat emergencies, but there's no appointment, no test, and no billing code for the quiet day before, the day your body is trying to warn you.
That's the gap we're closing today. If this video helps you catch a warning sign in time, hit subscribe. It might be the most useful thing you do all week. Most people believe a stroke strikes without warning, like a bolt of lightning. That's a myth. A stroke is usually the end of a process, not a sudden event.
Often, the body sends an early signal called a TIA, a transient ischemic attack, or mini-stroke. It happens when blood flow to the brain is briefly blocked, starving part of it of oxygen for just a few minutes before flow returns. That brief blockage can cause strange, easy-to-dismiss symptoms. Here are the 8 signs most people miss the day before.
The first sign is sudden trouble finding your words. You're in the middle of a sentence, and the word just isn't there. Maybe you're talking about your grandson's birthday, and the word cake disappears. You know exactly what you mean. You can picture it, but the word won't come. So you pause, laugh it off, and say, "Oh, I'm having a senior moment." Here's what's really happening. Deep in your brain, there's a small area responsible for language. It pulls up words the moment you need them, almost like a filing cabinet that never sticks. But when blood flow to that area is briefly interrupted, even for a few minutes, the cabinet jams. The words are still there. Your brain just can't reach them fast enough. Most people blame this on being tired, distracted, or getting older. It feels harmless, so it gets brushed aside. But this is not a memory problem. Memory loss is slow. It builds over months and years. This is different. It's sudden. It comes out of nowhere, in the middle of a normal sentence, and then it's gone just as fast. That suddenness is the clue. A true senior moment doesn't appear and disappear in 60 seconds. A circulation problem does. When blood flow to the language center is cut off, even briefly, your brain simply cannot do its job until flow returns. If this has ever happened to you, or to someone you love, don't wave it away as a bad day or a tired brain. It may be your body's way of sending an early signal, one worth paying attention to. The second sign is a heaviness or weakness on just one side of your body. Maybe you're carrying a bag of groceries and suddenly one arm feels strange, like it's dragging or made of lead. Or you're walking to the mailbox and one leg feels a little clumsy, like it's not quite listening to you. It only lasts a few minutes. Then it fades and you carry on, telling yourself you must have slept on it wrong. Here's what's actually going on. Each side of your brain controls the opposite side of your body. When blood flow to one side of the brain is briefly blocked, the muscles on the opposite side lose some of their strength and coordination. It's not weakness from age or tired muscles. It's a temporary loss of connection between your brain and your body. Studies show that nearly 1 in 3 people who go on to have a major stroke
report this exact kind of one-sided weakness in the days or hours before. That number matters because this sign is one of the easiest to brush off. The key detail is that it only affects one side. Everyday tiredness or muscle strain usually spreads evenly, or it's tied to something you did, like lifting something heavy.
This is different. It shows up on just one side of your body, without warning, and then disappears just as quickly as it came. If you ever notice one arm or one leg suddenly feeling heavy, weak, or out of your control, even briefly, take it seriously. Your brain may be trying to tell you something important. The third sign is one that almost nobody talks about, and that's exactly why it's so dangerous to miss. It's a sudden change in vision, but only in one eye. Picture this. You're reading the newspaper, and suddenly it looks like a dark curtain is falling over part of your view in one eye. Or everything in that eye turns blurry or dim, like someone dimmed the lights on just one side. It lasts a minute or two, then clears completely. You blink, rub your eyes, and think, I just need new glasses. Here's what's really happening. The blood vessels feeding your eye and the blood vessels feeding your brain are closely connected. When a tiny clot briefly blocks blood flow to the eye, it acts almost like a preview of what can happen in the brain itself. The retina, the part of your eye that senses light, temporarily loses its blood supply. That's what causes the curtain-like blur. Most people blame this on eye strain, dry eyes, or simply needing a new prescription. It seems minor, especially since it clears up fast and doesn't hurt. But eye strain does not affect just one eye and does not disappear in under a minute. This does. That's the detail that sets it apart. It happens suddenly, affects only one eye, and resolves quickly, almost like nothing happened at all. But nothing about it is nothing. It's your blood vessels sending a signal, using your eye as the messenger. If you ever experience a sudden curtain, blur, or dimming in just one eye, don't wait for your next eye appointment. This is worth mentioning to a doctor right away. The fourth sign is a headache, unlike any you've had before. One that hits hard and fast. You've had headaches your whole life. The kind that builds slowly after a stressful day, or the dull ache behind your eyes when you're dehydrated. This is not that. This headache arrives suddenly, within seconds, and it's severe right from the start. Some people describe it as the worst headache of their life. Others say it feels like a thunderclap. Here's what's happening inside your body. A sudden, intense headache like this can mean a blood vessel in or around the brain is under unusual strain, sometimes from a small leak or a brief interruption in blood flow. Your brain has very few pain receptors of its own, but the blood vessels and tissue around it are highly sensitive. When something changes suddenly in that blood flow, the pain response is immediate and sharp. This is very different from a normal tension headache. A tension headache builds gradually, often starts in the neck or shoulders, and responds to rest, water, or a pain reliever. This new kind of headache does not build slowly. It peaks almost instantly, often within a minute, and it may not ease up with your usual remedies. It can also come with other symptoms like nausea, sensitivity to light, or confusion. The speed and severity are the difference. A headache that goes from 0 to unbearable in under a minute is not a normal headache, no matter how many headaches you've had before. If you ever experience a headache like this, one that comes on fast and feels far worse than anything you've felt, treat it as urgent and seek medical care right away. Let me tell you about Walter. He's 68 years old, a retired mail carrier who spent 30 years walking the same neighborhood streets. Walter is sharp, active, and not the type to complain.
But 1 week, his body sent him 3 separate warnings, and each time he found a reason to explain it away. It started on a Monday. Walter was eating dinner when a fork slipped right out of his hand and clattered onto the plate. He laughed and blamed his grip, joking that his hands weren't what they used to be. 2 days later, he was on the phone with his daughter. In the middle of a sentence, a word slurred, just slightly, like his tongue couldn't quite keep up. His daughter asked if he was okay. Walter brushed it off, said he was just tired, and changed the subject. By Friday, he stood up from his recliner, and the room spun for a few seconds. He grabbed the armrest, waited it out, and told himself he'd stood up too fast. Nothing more.
It wasn't Walter who caught the pattern. It was his daughter, visiting that weekend, who noticed something small during a photo. Walter's smile looked uneven, just slightly drooped on one side. She insisted on an ER visit that same day.
A scan confirmed it. Walter had suffered a transient ischemic attack, a mini stroke, and his brain had been sending warnings all week long. The doctors were direct with him. If they'd waited 1 more day, that quiet mini stroke could have become something Walter never recovered from.
Here's a belief that puts a lot of people at risk. Many think that if their blood pressure reading looks normal, they're safe from stroke. That single number feels reassuring, so it's easy to stop asking questions after that. But blood pressure only tells part of the story. The real driver behind most strokes isn't just pressure in your blood vessels. It's the health of the vessels themselves. Think of your blood vessels like pipes in your house. Blood pressure tells you how hard the water is pushing, but it doesn't tell you if the inside of those pipes is smooth and clear or rough and inflamed. That inner lining of your blood vessels is called the endothelium, and when it becomes inflamed or damaged, it creates the perfect surface for clots to form, even when your blood pressure looks fine on paper. This is why it's worth asking your doctor about a few specific tests, ones that go beyond the standard blood pressure cuff. Ask about a CRP test, which measures inflammation in your body. Ask about a carotid ultrasound, which checks for narrowing in the arteries leading to your brain. And ask about your A1C, which reflects how your blood sugar has behaved over the past few months, since high blood sugar quietly damages vessel walls over time. These 3 markers paint a much fuller picture than blood pressure alone ever could. Age plays a role here too, since vessel health tends to change as the years go by. So tell me, how old are you? Write your age in the comments below. There's one more sign worth knowing: sudden loss of balance, or a wave of dizziness that comes out of nowhere. You might be walking across the kitchen when the floor suddenly feels unsteady, or you reach for the counter because the room seems to tilt. It passes in a minute or two, so it gets blamed on standing up too fast or simple clumsiness. But this can happen when blood flow is briefly disrupted to the part of the brain that controls balance and coordination. Like the other signs, the sudden onset and quick recovery are what set it apart from ordinary dizziness. Now that you know the signs, here are simple daily steps that support healthy blood vessels. No equipment needed. First, take a brisk 10-minute walk each day. Movement helps blood flow smoothly and reduces inflammation in your vessel walls. Second, add a handful of leafy greens or berries to one meal daily. These foods are rich in compounds that help protect the lining of your blood vessels. Third, practice 5 minutes of slow, deep breathing each morning. This lowers stress hormones that can otherwise raise blood pressure and inflammation. Fourth, cut back on added salt at meals. Excess salt makes your blood vessels work harder and can quietly damage their inner lining over time. Fifth, aim for 7 hours of sleep each night.
Poor sleep is directly linked to higher inflammation and unstable blood pressure over time. These are small habits, but done daily, they support the health of your blood vessels from the inside out, the same vessels responsible for every warning sign we covered today. Now let's be clear about when this becomes a true emergency, because these signs demand immediate action. Call 911 if you notice sudden face drooping, especially on one side. Call 911 if there is sudden weakness or numbness in an arm or leg, even if it seems to pass. Call 911 if speech suddenly becomes slurred, confused, or hard to produce. And call 911 if a severe headache strikes without warning, unlike anything felt before. Do not wait to see if it passes. Do not wait until morning. Do not drive yourself. Call for help immediately. Every minute matters when it comes to protecting the brain. I'm Dr. Ethan Kent, and after more than 20 years in cardiology, I can tell you this: the warning signs we covered today rarely show up on a chart. They show up in quiet, ordinary moments: a dropped fork, a stumble, a headache that feels different. There's no appointment built for catching those moments. That's exactly why this conversation matters so much. If this video helped you understand your body a little better, do two things for me. Hit subscribe so you don't miss the next video that could protect you or someone you love. And share this with a parent, a spouse, or a friend who needs to hear it today. You now know 8 signs most people miss and simple steps to protect your blood vessels every single day. Use that knowledge. Talk about it. Watch for it in the people you love. You may have just given someone you love a real chance.